The Modify program stands for Mentoring and Oversight for Developing Independence with Foster Youth. And we really develop that independence through post-secondary support and independent living support.
Okay, and before the break, we talked about some of the support services that you provide for education and for housing and independent living. But I know that there's some things that you help out with regarding medical care. Can you tell us about some of that?
Yes. One of the things that we're really trying to do some outreach is to former foster youth that there are some new medical provisions under the Affordable Care Act that might be available to them that they can get Medicaid for pretty much up until the age of 26.
Good. And now, are all former foster youth eligible for this?
The foster youth that aged out of care at the age of 18 are eligible. If they left foster care before that, then they're eligible up until the age of 21. And as long as they're not in another category, such as a pregnant person or living under a parent or relative caretaker or receiving SSI Medicaid, then they are eligible for this category that DHHR calls former foster care Medicaid.
And then how do they find out if they're eligible, and what is the enrollment process for that?
What they do is when they come in to complete the application, they do what is called a self-attestment. So they just let the worker know that they were in foster care, and then some behind the scenes work happens. The sort of Medicaid system talks to the child welfare system, and they verify whether or not that youth was in foster care and whether they were eligible or not. But services, Medicaid services, can start almost immediately.
And this is really helpful because medical insurance can be so expensive, and so having the ability to have that coverage, I'm sure, can really help people stay healthy. So what kinds of services are available through this?
Some of the services include everything from primary office care visits, specialty care, things such as chiropractic care, feet care, diabetes education. Hospital services are included, as well as emergency rooms, hospital visits, psychiatric services. Mental health is a big thing with our foster youth. We have a foster youth that experience things such as depression and bipolar and anxiety, so having those services available to them that they can go in to see the psychiatrist, they can go in to see their counselor, and of course prescription drugs are covered under the medical card.
Good. Now, Jessica, for youth that are interested in enrolling in this medical coverage, do they have to be residents of West Virginia?
They do.
Okay, and what about vision and dental?
Vision and dental are also covered under it. Vision, you get full vision benefits until the age of 21. After 21, you get some vision benefits, but it's limited coverage. Unfortunately, in the vision, it's never covered if it's just for cosmetic purposes. And then in dental, you get pretty much full dental coverage. There's some limitations to that, but most things are covered until the age of 21. After 21, it's only covered for emergent procedures.
Good, though. Having that dental coverage really can save a lot of people a lot of money and really contribute to your health and being a healthy person, because your dental affects your whole body sometimes. And then how do eligible youth sign up?
Well, there's 3 different ways they can sign up. The first is you can go to wvinroads.org and sign up online there. You can go into your local DHHR office, so any county in the state of West Virginia, or you can call the 1-877 number. I believe it's 1-877-716-1212.
Okay, good. And then Tina, once the youth are enrolled in the program, how long can they receive the benefits?
Youth can receive the benefits up until the age of 26. However, they have to be redetermined every year. They go through a redetermination process. They're contacted by the local DHHR, and they kind of provide where they're at. Unfortunately, if the youth moves out of state, they are no longer eligible for West Virginia Medicaid. So that can terminate coverage. But, it's really fantastic that the Affordable Care Act opened this up, because from 18 to 26, that's a long time. And, when youth come out of foster care, those medical benefits are so important, and a lot of time we really want to get the word out because they don't know that they can go to the doctor. They get the blue card in the mail every month, but they don't know that they can use it. And so, being on this show today, we're really hoping that we can reach out to those youth and let them know, hey, you can go get your medications. You can go to the doctor. If something's wrong, don't sit there and be sick. So it's really, really important, because your health drives your well-being.